Good evening and welcome to Pursuing Good Health, the Affordable Health Care Act, and you. I'm Romney Smith.
And I'm Matt Pritchard. What we hope to provide in the next half hour is an in-depth look into the Affordable Care Act.
Some things you can expect are questions from the public, answers to those questions, and a glimpse into the groups that will be affected by the new health care changes.
We'll also talk to small business leaders, health officials, and our local representatives about this new law in anticipation of open enrollment, which begins October 1st.
Now, while putting this special together, Fox 31 News heard a lot of questions from people just like you that were confused about how the changes are going to happen. Many wondered, would it be easy?
What difference is going to make in health insurance today? How easy will it be for me to obtain health insurance, and what the prices would be on it?
And some, like Dorothy Green, were looking just for the basics.
Well, honestly, I don't really know anything about it because I have heard about it, but the way it's going now, I'm not sure. Is it going to turn out like it should, or so I don't know. But hopefully everything works out for the best.
So the basics are probably where we should start.
Okay, so let's start with the term marketplace. This is where you will shop for health insurance. There are 4 categories of insurance you will find in the marketplace based on how you and the plan expect to share the cost. The categories include bronze, silver, gold, and platinum. All marketplace categories offer the same set of health benefits, and the categories do not reflect the quality or amount of care the plans provide.
The category you choose affects how much your premium costs each month and what portion of the bill you pay for things like hospital visits or prescription medications. It also affects your total out-of-pocket costs, meaning the total amount you'll spend for the year if you need lots of care. You'll learn if you can get lower costs on your insurance before you enroll in a plan.
Most people will be eligible for health coverage through the insurance marketplace, and there are some basic requirements you'll have to meet. You must live in the United States, you must be a U.S. citizen or national, or be lawfully present, and you can't be currently incarcerated.
The new Affordable Care Act will also be affecting business, both large and small. Congressman John Barrow outlined how those that are right on the teetering point of full-time and part-time could be tremendously affected by businesses trying to get underneath a capping point. If an employee is working more than 30 hours a week, they're required to provide health insurance for that employee, but some employers are looking to avoid that if they can.
There are problems of defining what a full-time employee is. There are a lot of employers that are going to be managing their compliance with this law by actually keeping folks in part-time basis or downsizing their employees' workforce into a larger number of folks working on a part-time basis in order to avoid having to comply with this law. All of these things are things we shouldn't be putting on business. They got enough to worry about.
Barrow says that this particular portion of the law could be causing more stress in the business marketplace, taking away from actual economic development.
And Georgia Senator Saxby Chambliss echoed that point, adding that there could be confusion among small businesses as to whether they have to provide health benefits for their employees.
There's a provision in the healthcare law that says that if you have 50 or fewer employees, then you do not have to provide health care coverage to your employees as a small business employer. What we're seeing now is that anybody is on the margin of having 50 employees, all of a sudden they're reducing their number of employees to get under that 50 employee cap.
So if your business has 49 employees, you are not required to put forward any health benefits. However, if the business has 50 or more employees, the business will have to provide benefits for each full-time employee on staff.
And obviously, small businesses take up a huge portion of this new law, so we sat down with the Small Business Association to get more details on company size and how some think their small business could in fact not be put in that category.
Employers are like, well, maybe I need to keep my employees below that, or I'm going to be forced to, I'm being forced essentially to provide insurance. And the reality is no one's being forced to provide insurance. If you are going to, you have to look at whether providing insurance is going to be more effective for you cost-wise and the overall health of the business over the long term versus paying the shared responsibility payment if you elect not to provide insurance as required by the law.
And with so many middle-class Georgians employed by small businesses, Fox 31 set out to see how the Affordable Care Act will affect them.
For Shaka Masters, lifting spirits and giving encouraging words has become an everyday reality.
I can only imagine how hard and difficult it is for a lot of my employees, but I can relate to it.
Masters is a manager at Fred's and says because of the new Affordable Care Act, his workers are losing hours by the minute.
Now that they've cut it into part-time and hours, it's affected a lot of the workers that depend on possibly having 25 hours or more during the week.
He says out of the 24 workers, the majority of them work part-time, bringing in less than $10,000 a year, a hard life when you're supporting a family.
Morale is a little low, but we try to encourage them to understand that there are sometimes other opportunities for them to possibly get full-time.
And that's just one way the new Affordable Care Act will affect middle-class Americans. John Crew with Strategic Healthcare Partners says there are options out there.
The idea that everybody is going to have to buy health insurance is not accurate. There are going to be a lot of exclusions, and you, as an individual, you want to find out whether you're part of eligible for any of those exclusions.
Under the new Affordable Care Act, all Americans are required to secure health care insurance or face a penalty.
For 2014, it's $95 for an individual. It's $47.50 for each dependent child, up to a maximum of $285 for a family, or 1% of your income.
He says those who choose not to get health insurance through their employer can buy it through government-run health insurance exchanges.
If your employer continues to offer health insurance and your premiums through your employer are not more than the government's requirement of that percentage of your adjusted gross income, then that's where you buy it.
Crew says people buying health coverage through these exchanges will be eligible for federal subsidies in the form of a refundable tax credit, as long as their adjusted gross household income is between 100% and 400% of the federal poverty level.
If for any reason you don't file it on your tax return, and it's determined, the IRS determines that you should have been penalized, they have the ability to take out of any future refunds, they have the ability to take those fines out of those dollars.
But with all that, he says there is a question you should ask yourself.
Is my employer going to continue to offer health care coverage, or are they going to use this as an opportunity to get out of offering health care coverage?
Crew says the biggest obstacle facing the middle class is not being educated on how this new law will affect you. Frenton White, Fox 31 News.
Welcome back to Fox 31's 30-minute special Pursuing Good Health. Moving forward, there are a couple of key dates you need to write down. October 1st is when open enrollment starts, and you can search the marketplace for insurance. The earliest health care coverage start is January 1st, 2014. Open enrollment ends on March 31st.
And with enrollment right around the corner, many of you have questions about how the Affordable Care Act will affect anyone using Medicare or Medicaid.
I hope it's not like Medicaid. When you don't do your information on time, they cut it off, and your child has to go a while without Medicaid. I have a sick child, and she constantly needs her Medicaid. So I'm hoping that it's affordable, it's beneficial, and all.
Our local congressional representative stopped by Fox 31 to explain how Georgia not expanding Medicare and Medicaid will affect residents in our state.
Georgia has opted so far not to participate. That's an unfortunate decision, because if they expand Medicaid, which will make it available to those people up to 400% of the poverty level, it means that the federal government would pick up the cost of adding those additional people for 3 years. Then after that 3 years, the state would only have to assume the cost of 10%, which is a real bargain, given the fact that if all of the provisions of the Health Care Act are going into effect and implemented, that it will reduce the cost of health care overall for everyone, and ultimately save the state's money, particularly with indigent care and many of the other provisions that can be made more efficient in the provision of the health care, ultimately saving more than 10%.
And as you navigate through the marketplace for coverage, it will tell you whether or not you qualify for Medicaid or the Children's Health Insurance Program called CHIP. If you qualify for either of these, your coverage can begin immediately. You can't be refused coverage or charged more because of a pre-existing condition under these policies.
And staying on that topic, there are provisions built into the legislation to protect people with pre-existing conditions.
One of the things the Affordable Care Act does is prevent people from being denied care because of pre-existing conditions, and it also addresses some of the cost issues that are involved with people with a history of very high utilization. It keeps it more affordable for those folks.
Now, one of the most talked about parts of this new law is the provision that encompasses pre-existing conditions, which Georgia lawmakers seem to feel is a beneficial part to this new form of health care.
There are some beneficial provisions to the law. For example, coverage of pre-existing conditions. That's an expensive measure, but it is a good measure. Somebody who has not been able to get health care before, who has a long-term illness, will now be able to get health care coverage, and their medical bills will be paid.
Moving on, seniors will also be affected by the Affordable Care Act.
And just like everybody else, they also have questions about how it will be affecting them.
Basic concerns that I have about the care is the cost. Will it help for the senior citizens as well as the senior citizens as well as ourselves? And basically that's all I really was interested in, if we have to pay more, deductibles, or what have you.
And here's some more information that we found out that will hopefully clear up things for Clarice and others.
When it comes to how the Affordable Care Act will affect senior citizens, as with everything, there are pros and cons. Let's start with the cons. The majority of seniors are on fixed incomes, and with the rates of premiums increasing, prices of virtually everything else will increase as well.
Generally, when costs increase on business, then prices in the market increase, whether that be for your cable or for your rent or your groceries, whatever your normal day-to-day things are that you need to survive. We expect those prices are going to go up. There's no question they're going to go up. The question really is, how much is it going to go up?
Prices are increasing and accessibility to doctors could be decreasing, both of which aren't ideal.
If you've got access to, say, 20 doctors, you can pick which of the 20 you want today. You may only have access to 3 or 4.
There are positive changes as well, though. With the Affordable Care Act, pre-existing conditions will be covered. Plans won't be able to deny you coverage or charge you more due to pre-existing health conditions, including a disability.
You can be diagnosed with cancer in the morning, and you can have insurance to cover cancer that afternoon.
If you're on Medicare, officials say the Affordable Care Act will only make your life easier.
Individuals with Medicare now have access to a number of preventive services that are available to them with free or no cost as a result of the Affordable Care Act. So colonoscopies, blood pressure screenings, bone density screenings, to name a few, are covered for individuals with Medicare.
Open enrollment for Marketplace plans starts on October 1st. Courtney Highfield, Fox 31 News.
Welcome back to Fox 31's 30-minute special Pursuing Good Health.
The next step on our journey is to talk about premiums.
If you enroll in a private health insurance plan anytime between October 1st, 2013 and December 15th, 2013 and make your first premium payment, your new health coverage will start on January 1st, 2014. Now, during the rest of open enrollment, if you enroll between the 1st and 15th day of the month and pay your premium, your coverage begins the first day of the following month. So, if you enroll on February 10th, 2014, your coverage begins on March 1st, 2014.
Now, if you enroll between the 16th and the last day of the month and pay your premium, your effective date of coverage will be the first day of the second following month. So if you enroll on February 16th, 2014, your coverage starts on April 1st, 2014.
Hospitals around the country are also preparing for major changes that come with the Affordable Care Act. Hospitals like Tift Regional Medical Center recently joined with 29 other hospitals to have the ability to remain independent but still use shared services. And when it comes to service, all hospitals are shifting from a fee-for-service to a fee-for-value model, meaning instead of the more you do, the more you collect, hospitals will be rated on the quality of care they provide.
In the future, Medicare and Medicaid will reimburse the hospital based on clinical outcomes, things like your readmission rate for your hospital infection rate. How well do we do in overall coordination and quality of care? These will be the things that the government, Medicare and Medicaid will look at to reimburse the hospital for that care, and not specifically for each service rendered.
Tift Regional predicts the more people gain insurance that they'll see an increase in outpatient care and perhaps a decrease in inpatient care. Either way, they say the goal is to improve the quality of care while reducing the cost of care.
And the other major healthcare player in town is the Phoebe Putney Memorial Health System. Now, we sat down with officials to ask how this will affect their employees and, more importantly, how it will affect the thousands that go there for medical attention.
They'll never not have access to emergency care. We have to provide that. It's part of our mission. It's part of what we do everywhere we are. But it's this access to the non-emergency care that is the critical thing for patients.
So the ER won't change, but there will be other changes, such as Phoebe receiving less money for services they're providing, which begs the question, will Phoebe raise their rates?
What we're trying to do is prepare ourselves for that volume to value shift so that we can increase our reimbursement opportunities based on performing at higher levels of quality as opposed to relying on price increases or additional volume.
And if you're one of the thousands that work for Phoebe, they're going through two major changes as well.
Added access to preventive and wellness benefits are highly enhanced under the Affordable Care Act.
The Affordable Care Act is also making it possible for more Phoebe employees to receive health care coverage.
With the new definition of full-time being 30 hours per week on average, you will now have a new subset of employees that are now eligible.
Phoebe officials say they have a plan to make sure all of their employees are adequately informed through various resources, and say the public will receive help as well.
We hope, as we get closer to that time, to be able to offer some resources to people and be able to at least guide folks. We intend to have people who are inside our environments who become knowledgeable about that as we learn.
Thus far, the implementation has not been that overwhelming. However, in years to come, I would say in the next 2 years are going to be the most telling. Number one, because I think more of the real meat of the legislation is going to be revealed. Some of those questions, have yet to be answered.
As Phoebe works through their system, they're keeping an eye out for their employees and patients, but also realize we're in a different position when compared to the rest of the state.
Especially in an environment like we face here in Southwest Georgia, where there's a lot of poverty, a lot of folks living in the low income levels. We don't have that cushion of that you might find in some of the suburban areas of Atlanta, for example, where the employment rates are better, the average income is higher, education levels are higher. People are able to afford the insurance there and are less likely to get kicked out of their insurance plan and into the exchange.
In regards to the dental industry, experts say patients will likely see little change, most of it coming directly to offices and not affecting patients.
It will have a minimal impact. The only real potential is that if those who were not insured medically now become insured, if there is a dental component to their insurance, then we may see a few patients coming from that.
Welcome back to Fox 31's 30-minute special, Pursuing Good Health. We're diving into the new Affordable Care Act and explaining what you need to know about open enrollment.
With 3 local colleges and universities in Southwest Georgia, there is a sizable young adult population.
And both here and around the state, students have questions about upcoming changes.
How does Obamacare affect me when I want to stay on my parents' health insurance?
How does Obamacare affect me as a student?
So we went out and spoke with local college officials to find out what students and young adults can expect to change moving forward.
An estimated 123,000 young adults in Georgia have already been affected by the Affordable Care Act as of December 2011, when a provision was put into place allowing them to stay on their parents' health insurance until age 26. But those who aren't covered and are financially eligible for health care will face a penalty.
If you don't have health insurance and you're a young person and you've finished with college, you get a job and you don't take your health insurance and your parents aren't covering you, then you're going to have to pay that fine.
The cost for not purchasing a plan to receive care in 2014 is either 1% of your yearly income or $95, whichever is higher, plus an extra $47.50 for each child, and requires the student to pay the full cost of the service they receive.
I think the group that is likely to be impacted more by this change are the people who are a little bit older, who are not living with their parents anymore, or may not be able to stay on their parents' plan.
But the new guidelines will also allow some students who need care to become insured, as the Affordable Care Act bans denying coverage because of a pre-existing condition and also prevents insurers from placing a lifetime or monthly limit on the cost of care.
It allows them to not only seek medical care, but it allows them to have a medical home, because many students do not have a medical home, meaning they have not chosen a physician that they can attend to on a regular basis. So this allows them to have a medical home.
School officials say diagnosing or treating a chronic illness in a young adult can extend a student's lifespan, and add that having access to that kind of care at a four-year institution is as easy as visiting the Student Health Services Center, who offers multiple plans.
The more coverage they choose, of course, the more the premium will be. And it allows them to pay by the semester, by the month, by the year. It also allows them to cover their dependent children.
Those at two-year colleges and universities may have access to different plans depending on the school, but most technical colleges only offer accident coverage. Despite the fact that many students are safe under their parents' plans, they say their concern is what happens after they turn 26 in a time when unemployment is high.
I'm trying to go through college, get a job, and get my own insurance, so I won't have to. I won't ever be affected by it. That's my goal.
Both school officials and students say they hope the extra pressure to find a job with benefits after graduation won't cause a decrease in enrollment, and add that they're in a wait-and-see mode to see how the Affordable Care Act really affects the education system in Georgia once it goes into effect. Colby Gallagher, Fox 31 News.
And the penalties apply to everyone, not just young adults. So if you decide to opt out, here's what you can expect to pay.
It would behoove them to really do the research on it, because those people who are not exempted and who should be under the mandate will either have to pay $95 for individuals plus $45.50 per child, up to a maximum of $285 in premiums, or 1% of their annual income, whichever is higher. So in all likelihood, by purchasing the insurance through the exchanges or through an employer with the increased provisions that are allowed under the Affordable Care Act, it will be cheaper for the average individual to enroll in a plan or to buy a plan through the exchange. And I think that it probably will be beneficial. But again, that's something that I think people should do the research on. With the likelihood of someone coming out better by paying the penalty, I don't think it's very good.
Now here is some important information you're going to want to pay attention to. After March 31st, 2014, you will only be able to get new private health insurance for 2014 through a special enrollment period if you have a qualifying life event like a job loss, birth, or a divorce.
Okay, we know that over the past 30 minutes we've given you a lot of information, and you may be wondering where you can get more details on the Affordable Health Care Act. Not to worry, as officials have already worked that out.
You will see over the summer various approaches put in place. First, at healthcare.gov, which is the website where you can actually do an online automated application if you're so inclined. There will be a 1-800 call center that will be staffed 24/7 that will provide information, and then we'll also have in-person assistance, including working with lots of volunteers in Georgia and other states to get that done. We will be able to explain to individuals if they're eligible for tax credits and what those tax credits are, and we'll be able to have them put side by side on a website or manually what plans are offered in their area and how much those plans would cost an individual.
Again, thank you for joining us. We hope you've learned some key takeaways from this 30-minute special. If you have any other questions, you can visit healthcare.gov or call 1-800-318-2596.